All right, John. So let's go over the assessments that you completed. You took the Beck Depression Inventory, Anxiety Inventory, the Hopelessness Scale, and the Scale for Suicide. So let's start with the Beck Depression Inventory scales. Scores from 0 to 13 would be minimal depression, 14 to 19 mild, 20 to 28 moderate, and 29 to 63 severe. You scored a 32, which puts you in the severe range. We're going to want to retest in a couple weeks, see where your score lands. Because if it is high again, I believe it's above a 32, 28. If it's above a 28, then we are going to want to discuss possibly referring you to a psychiatric evaluation, maybe medication. But that is not a decision within my scope of practice. Yeah, so we're going to want to re-administer this throughout therapy and see if there are any changes in your symptoms. The Beck Anxiety Inventory ranges are kind of similar, 0 to 7 minimal, 8 to 15 mild, 16 to 25 moderate, and 26 to 63 severe. You scored an 18, putting you in the moderate range. And so we're going to also probably want to re-administer that to monitor for some changes. It looks like you endorsed some somatic symptoms of anxiety. You feel shaky, faint, you feel hot sometimes, and you also endorsed some panic-related symptoms, your fear of losing control, fear of dying, scared, unable to relax, heart pounding or racing. So we're going to want to keep an eye on those, re-administer this probably sometime in the future to monitor for any changes. In terms of the Beck Hopelessness Scale, those ranges would be 0 to 3 for normal, 4 to 8 for mild, 9 to 14 for moderate, and anything above 14 would be considered severe. You were at a 13, so you're at the high end of moderate. And this really assesses your feelings about the future, which when we discuss that here, you responded true to statements saying that your future seems dark, that you can't get any breaks and there's no reason you will in the future, that things don't work out the way that you want them to. And you said false to being able to look forward to more good times than bad times. And in the future, I expect to succeed in what concerns me most. That was also false. Um, so this assessment is a big predictor of possible suicidality, and that matched with your depression inventory. It is a bit concerning. Um, Moving on to the Beck scale for suicide, it's just a range from 0 to 38. The higher the value, the greater the risk. You scored a 2. Um, so there is a little bit of a discrepancy between what you endorsed on the Beck depression inventory versus the suicide scale or the scales of suicide. So on the BDI, the depression inventory, you said that I would kill myself if I had the chance. Whereas on the Beck scale for suicide, you said I have a weak wish to die. I have no desire to kill myself. I have a moderate to strong wish to live. So I think we should probably explore that and kind of see where that discrepancy is, and make sure that we're understanding what we're answering these questions to get a really more accurate read of how you're feeling currently. And based on your depression inventory score being so high, I think we should probably talk about creating a safety plan to keep you safe in the future while we work through these.